Seed Global Health was started in 2012 out of a deep belief that every person in the world deserves quality health care, and the two standards, those with access to trained medical professionals and those without, cannot continue. We place qualified and experienced educators who serve as part of the faculty, building the capacity of faculty and supporting the delivery of training of students. In Malawi, we have partnered with government, education, and health institutions to invest in those who make better health care possible. We know that good treatment starts and stops with those who take care of our loved ones. We support the education and training of doctors, nurses and midwives for a workforce that makes a difference. We have 7 partnerships, which include 5 departments of Kamuzu University of Health Sciences, St. John of God, that supports training of mental health professionals and provides mental health services to surrounding districts. Seed Malawi equally supports the Nurses and Midwives Council of Malawi, which is a regulatory body for training, practice, and professional conduct of nurses and midwives in the country. We focus our work on 3 thematic areas, namely maternal, neonatal and child health, community health, and mental health. Our training models don't just educate, they empower. All courses are underpinned by hands-on training for a healthcare workforce that serves with confidence and experience. Together, we are investing in tomorrow, today, to deliver much-needed countrywide impact. The government of Malawi plans to have at least 2 family medicine doctors in each of its 28 district hospitals. We are supporting the Kamuzu University of Health Sciences Family Medicine Department in the training of family physicians so that we have a pool to help the Malawi government meet its target of having a minimum of 2 family physicians in each district.
So SEED supports the Department of Family Medicine through providing educators who are involved in teaching undergraduate and postgraduate students. So that helps to cover some of the shortage of staff that we have within the department, and also looking at the student perspective, especially the postgraduate student. Our students are enrolled in certain key training programs like point of care ultrasound, which helps indeed in clinical decisions as far as patient care and management in primary health care setting is concerned.
Zinanga nijofulakidwe nimakaa kuno kumlongosha moyo wanga time minutes nambe kuma mankwala moyo wangu nali ngovuta kwambiri moti kuyenda sini makwanisa ni mango kala chicho sasa ni mapanga mwande kai ni machita upangilidwa kunyamulidwa hivi nopita ku toilet ni mataka kunyamulidwa chicho andi chambeni kuma mankwala bano pa moyo wangu uliwosi ntiwa kwambiri moti zinthu zimene sima kwanisa kupanga mu pano panga mwa inendeka bano pa business yanga nomata kutamanga muno bwino chilo zaba koma ndikugwira buno bwino moti chicho sasa chili buno bwino sapano kutenga ndi mbuyo ndi mmene nalili.
The Midwifery Ward at Kamuzu University is the first of its kind. Led by midwives with decades of experience, the practical training offered has transformed the midwifery ward. Keeping the education hands-on will ensure the promotion of safe deliveries and minimal intervention of doctors in line with the midwifery model of care.
Seed Global Health has been instrumental in establishing this initiative at Limbi Health Center. They have assisted us with a lot of things, including renovating the facility, making it conducive for student teaching as well as care for our mothers. They have also provided all the resources that are required for caring for mothers in the maternity unit. And during the COVID-19 pandemic, SEED has also been very instrumental in providing resources for COVID-19 prevention, which our students have utilized, including the staff, and even at the health center, we have provided some of these donations that were given by the SEED Global Health.
Our line of care doesn't end with birth. We support gynecological and pediatric care. The current mortality ratio for Malawi is still high, standing at 439 maternal deaths for every 100,000 mothers, rates that are simply too high. In keeping with our values to enable Malawi to achieve a dignified and responsive health care to women and newborns, we support the Department of Obstetrics and gynecology.
We were trained about postpartum family planning methods by SEED Global Healthy last year, and since we were trained, it has helped us to provide proper counseling to our women. When we are admitting them, they are able to choose what type of family planning they want to get after delivery.
One of the priority areas of the department is capacity building, particularly among workers that are serving the community, so particularly health workers in health centers. So we do different workshops aimed at equipping them with emergency obstetric drills that are aimed at improving both maternal and child health outcomes. And this has been made possible with in partnership with SEED Global, such that we're able to hold such activities at least once every quarter.
Malawi struggles with 22.7 deaths for every 1,000 live births. The Department of Pediatric Child Health is the only school in Malawi that provides medical training for pediatricians. We proudly work with them towards reducing the neonatal mortality ratio by improving the quality of education and training of pediatricians in Malawi. SEED has supported the revision of the curriculum for the training of pediatricians and other key elements of the training, including building the capacity of the pediatrics and child health faculty.
We've been in partnership with SEED Global Health since 2019, and over the past 3 years we've achieved a lot. I'll just mention a few things that we've achieved. Through our partnership, we've managed to review our postgraduate program, the Master of Medicine in Pediatrics and Child Health curriculum. We've taken feedback from different stakeholders, and we've made it into a curriculum that is desirable to the benefit of the country, Malawi, and also for the children of Malawi. The curriculum is now approved by Senate, and the candidates that have started training this year will undergo that curriculum. Also through the partnership, we've done several trainings, one of which is the training in assessment and also education, especially for postgraduate students. At the moment, we've started putting students in Lilongwe at Kamuzu Central Hospital. We've got a candidate there, and this was an opportunity to improve on how we train our postgraduate students, and also to share experiences with our colleagues from Lilongwe. So we've really benefited a lot, and we're grateful to SEED Global Health for this partnership.
We have also supported the extension of the residency training to Kamuzu Central Hospital so that more students can be enrolled into the residency program, leading to increased number of qualified pediatricians being produced by Kamuzu University of Health Sciences. We equally support the Department of Pediatric Critical Care with a focus of instituting child critical care nursing as a separate established practice in Malawi, innovating for our future.
We decided that we are going to enter into partnership with SEED so that we should come up with specific training at master's level, and that's what we have gone into, and that's what we are pursuing at the moment. We've done quite a lot in terms of the preparation. We've developed a curriculum that is about to be approved by Senate, and we have also assisted Malawi in coming up with competences that are to be applied anywhere. So any training institution in Malawi, if they want to come up with a new program in training nurses who are able to provide care to sick children, they can go to Nurses and Midwives Council and get the competences that we have developed in partnership with SEED. They can use that to develop their own curriculum and train nurses.
We are proud that our work doesn't stop in the hospital. It extends to advocacy for the biggest human resource in the healthcare system. SEED Malawi supports various activities to promote policies that benefit nurses, midwives, and physicians in the country. One highlight was the launch of the Year of the Nurse and Midwife in the country alongside the WHO, UNFPA, and the Nurses Organization of Malawi.
As a regulatory body, we develop documents that guide the profession in terms of delivery of the nursing and midwifery services in education as well as in practice. So we had the partnership with SEED Global Health. SEED Global Health helped us in the development of a number of documents
to guide the profession as well as the training of nurses and midwives. For example, we developed the master's standards for master's degree in nursing and midwifery education. We developed these standards because we felt that there was a gap. It was difficult for the Nurses Council to regulate the nurses and midwives who have been trained at master's level, because apart from being an academic award, but the nurses also improving in their skills as well as competencies. So we need to have standards that will help us to guide the training of nurses at master's level to ensure that the nurses have indeed improved in their knowledge, skills, as well as competencies in the provision of care.
Our work strives for healthier communities in all aspects, namely physical, mental, and emotional. Through pharmaceutical and non-pharmaceutical practices at St. John of God, we make it possible for people to reach out and find support in times of need. The training we support will lead to availability of more qualified mental health professionals in Malawi for improved mental health care for the mental health clients.
And there were a number of areas that we agreed that SEED could assist us, especially in capacity development. So the partnership focused in the areas of capacity development for increasing human resources for mental health in Malawi. So SEED has been helping us in training of psychiatric nurses as well as psychiatric clinical officers in our College of Health Sciences. Aside of that, they have been sending educators that have also been providing capacity to our trainers in the College of Health Sciences.
We also support St. John of God in their advocacy work to ensure that the primary healthcare system has qualified mental health professionals and psychotic drugs available for improved mental health and care service delivery. Our work is an investment in human life and human dignity, and everything we achieved to date has been possible because of our funders and partners who have journeyed with us. We could never do this work alone, and we applaud our 7 partner institutions for their commitment to meaningful and long-term impact across Malawi.